So the first slide is the learning objectives. And basically today I'll describe the developmental onset characteristics of the most common challenging behaviors in Prader-Willi syndrome. And then you will learn strategies for prevention and management. And Marguerite, if you could flip to that slide, that would be great. And then just move to the next one. To the next slide, please. Whoop. Okay, so the previous one, I'm sorry. So there is a YouTube presentation on developmental tasks of the person with Prader-Willi syndrome that was taped and put on YouTube without my knowledge, but it turns out to be a really good tool for parents and also for people who are other carers in the community. And so it looks something like this, but it goes through infancy, preschool, all the way up until adulthood. And it looks at developmental tasks of the child, of the family, and also what is required of the community. So please, if you have a chance, look this up because I think you will find it very informative. Next slide, please. So the Prader-Willi story is very complicated. And to understand challenging behaviors, you really have to understand the explanation of the phenotype in Prader-Willi syndrome. So if you can go ahead and go ahead, just load all of those, you'll just, the phenotype, keep going. So the hypotonia and inability to suckle, as Suzanne has described, is usually followed by a prompt diagnosis. The hypotonia has its own trajectory and is responsible for many other behaviors that we see in the syndrome, such as sensory processing problems and sensory hunger that is responsible for excessive and repetitive behaviors, and also habit behaviors such as skin picking. The baby, the infant is so fragile and yet so resilient, because from that state, the child not only survives, but also thrives and begins to eat. And reward drives that behavior, but the mechanisms of satiety and knowing when is enough and when to stop are deficient, and they're deficient from that point on. Cognitive rigidity, which is defined as an inability to change beliefs and behavior when flexibility is required. It may be the most enduring attribute of the behavioral phenotype, but stress sensitivity is the most pervasive and predisposes to mental health conditions. And Yvonne, I want to thank you for your presentation on teaching cognitive flexibility. It was lovely, and it's a dance, and that's the way it should unfold in PWS. Next slide, please. 15 years ago, my colleagues and I did an interactive survey of behaviors in a community sample of individuals with Prader-Willi syndrome of all ages, and they were living with their families. And we looked at the degree of stress perceived by their parents. And so next slide, what did we learn? We learned that food interest increases around 2 to 3 years, around the same time that the first tantrum occurs. And this may reflect the maturation of reward centers in the brain. The tantrum precedes the display of food-related behaviors, and I want to emphasize that. So repetitive asking about events emerges as soon as children can talk, and it's actually more intense than arguing or talking about food. So they want to know what's happening next. The next one, temper tantrums and problems with transitions increase steadily, peak around 8 to 10 years, and remain at high rates even through adulthood. Children do not outgrow their behavioral challenges, although older individuals display a trend toward fewer food-related behaviors. And that's important and also anxiety-provoking, but I'm going to tell you about some skills to help you with some of these challenging behaviors. So the first one, if you can flip to the next, I'm going to be talking about food-related behaviors, temper tantrums, perseverative questioning, and problems with transitions. So the first is managing food-related behaviors. You can turn to the next slide, please. All parents are excited and thankful when their young child with Prader-Willi syndrome finally starts to eat and enjoys food. But this is the time to begin some interventions to help prevent problems from occurring in the future. So first of all, teach my food and your food so that the child can make that distinction. Don't allow the child to eat off of other people's plates. This is part of the overall strategy to teach the child with Prader-Willi syndrome about their special body and their special food that their special body requires. Okay, the next one, please avoid just this once. It is something that your child will never forget, and it then becomes an expectation. And the next one is, remember that supervision is required in all food situations. And just so you know, some individuals with PWS will benefit from a visual display of the menu. Some will just automatically know it. So food security, this is an important concept that was developed over 20 years ago. But even before that, we recognized that managing food access with locks and alarms was life-saving for individuals with Prader-Willi syndrome. But 20 years ago, our work with people with PWS of all ages showed us that if you put a lock on the thought related to food, both food and behavior can be managed at the same time. And so there is no doubt that the child will have their food, their meals, and their snacks. No chance that they will get it any other time or get any more, even if they ask for it. And then there is no disappointment. And the important thing is no disappointment, because usually that results in a tantrum. Next, please. So we revised the food security paradigm to be more child-focused. And so the child knows what it is that they're going to eat. They know how much they will eat. That is portion control. They will know when they are going to eat it, and that's the daily schedule. And they accept these things. And then they are content. And that's the important thing, because contentment is sort of like the the vaccine for the temper tantrums and the behavioral disappointment. So next, food security manages both food and behavior. Without food security, you're constantly battling your child's expectations, which inevitably lead to disappointment and a tantrum. And the unique thing about Prader-Willi syndrome and their ability to learn in context, they do not forget. And so when they're placed in another context that you don't recall at all, but the child does, the expectation that there will be food is there, and it inevitably results in a tantrum. You can fast forward, Marguerite. So when the child is not constantly thinking about food, they can use their mind for other things. And this is so important. And that's the final. Okay, so if you think of disappointment as a tantrum, the tantrum, or you can call it an outburst, which really better conveys the disturbance as a manifestation of the person's distress. It's a behavior that occurs when a child expects that something will happen, but it does not. It occurs universally in children with Prader-Willi syndrome, and it is similar to the tantrums that the typical children display. But in Prader-Willi syndrome, it is more intense. And I put down here, it lasts a lifetime, but it doesn't actually last a lifetime. It has a time-limited display of behavior. But children don't outgrow them, and they do persist in adulthood. Each child's tantrum has a unique profile. It is stress-related, and not the profile, but the tantrum. And it is physiologically based and related to an imbalance in the nervous system of individuals with PWS. So the next slide is this complicated technical slide that looks at the balance in the autonomic nervous system. But I want to give you this display that the sympathetic part is related to stress. And the parasympathetic there's a happy face. It's related to relaxation and contentment. And the balance between these two things is homeostasis. And this balancing mechanism is broken in Prader-Willi syndrome. So the child is constantly sort of teeter-tottering between stress and contentment. And I think that in some ways, some of the phenotypic behaviors that the children display are actually trying to stimulate this parasympathetic part of the nervous system to help counterbalance some of the stress. So the next slide is the other side, which looks at the relaxation aspect of it. And so in the typical person, these two parts of the nervous system are balanced. In Prader-Willi syndrome, the parasympathetic response is diminished. And this may in fact be regulated through the vagal nerve. And Dr. Holland did this experiment with using the vagal nerve stimulator, and he thought that it would affect appetite, but it actually decreased temper tantrums and improved the adult's adaptability. And so if we can increase this parasympathetic input by a variety of ways, we can help the individual. So the next slide is basically the anatomy of the tantrum. And so I want you to look at the numbered areas, because it's numbered 1 through 5, because these are the phases of the tantrum. And like I said, this is a typical tantrum. Your child may have a different profile, but for this child and the most children, number 1 is that phase of escalating stress, which is almost inevitable that it will occur. We can do things at this stage to counterbalance that stress and to help introduce relaxation techniques and better coping skills, but it will inevitably move to station 2. And in station 2, there is really no capacity to go backwards. In this particular state, there's arousal, there's both neurochemical and physiological changes that have occurred, and the child is not receptive to any kind of environmental input that will modulate what is about to happen. Stage 3 is in fact the tantrum. And this is related, all of this from 1 to 2 to 3 is related to stress. Once the tantrum occurs, or it could also be a shutdown, by the way, it is inevitable to have a time of eventuation. So in other words, they typically last a certain period of time, because if you think of the tremendous amount of neurochemical change and physiological change that goes into the body, they can't last an indefinite period of time. Most tantrums last about 20 minutes. It is my understanding that some can last, they sort of blow up and then they sort of become more diminished, and then they blow up again. And so they can go on for quite a while, including hours, but most of the time it's time limited, about 20 minutes. And then at point 5, there's a sense of reaching back to baseline. And so in many ways, and their stress tolerance is much better at number 5. And so it has led some people to believe that the tantrum is actually sort of a reset switch for this imbalance that happens in the nervous system. So the thing is that in phase 5, children are over the episode, and they may not even remember it, but we remember it. And so it is important to realize that the child is finished. And so to hold them accountable or punish or anything like that is just not appropriate. And we have to move on, which for us as parents and carers is difficult. Okay, next slide. So that's the stress paradigm, and we can move to the next one. So achieving contentment by increasing that green arrow, which is to improve parasympathetic input, is important because it occurs when a person knows what will happen next, when they maintain a routine, when they do preferred activities and repetitive activities, when they have opportunities to exercise, stretch, and do deep breathing across the day, that they have opportunities for sensory stimulation, like chewing, hugs from others, giving hugs, having massage, those kinds of activities. Could be bouncing, clapping, dancing, as Yvonne so nicely described, and also having the constant unconditional support and love from caregivers. All of these help achieve a sense of contentment and building a sense of autonomy for the child, that is related to a sense of mastery and control. Now I'm going to move to another paradigm, but I want you to know that all of these things we can do within the context of an intervention that we developed called the TRAIN. That's the next one, Marguerite. So the TRAIN is a tool for reducing anxiety, insecurity, and non-compliance. If you go to our website, you will be able to find lots of information about the TRAIN, about food security. We have a section in this website looking at materials for training and coaching that are actually done in Spanish as well. So if you move, you can talk about, well, I will tell you that the TRAIN is a linear tool that orders the daily schedule by alternating from non-preferred to preferred activities. And by doing that, it maintains a sense of flow across the day. The goal-directed behavior that is involved in all of these activities helps to establish mastery and self-esteem for the person. And also this sense of a routine across the day fosters independence and autonomy for the child. So knowing what to expect across the day reduces anxiety and stress. You can go ahead and move on. You can move to the next one, which is what I just said. I just want you to know that in our study, looking at behaviors across the lifespan, the more organized, structured, and consistent the household was, the less stress the family perceived. So the TRAIN is a very helpful tool. So if you can see, all of the aspects of the day are color-coded. I have them all defined here. When we're starting to put a TRAIN together for a child, we always queue up the meals and the snacks first, the hygiene and the grooming, and then also the exercise and sensory activities across the day. And so you can do this gradually for the child, and you can actually visually display it so that the child knows what all the elements of the schedule are for that day. Okay, we can move on. And so by using the TRAIN, the child actually ends up with everything security. By using the TRAIN, the person has the experience of knowing how everything fits in the course of their day. Next slide. So let's turn to repetitive questioning. So for your child, they are uncertain and anxious. They want to clarify expectations. They want to talk to you, and it's hard for them to stop talking, to listen, and to process your answer. They have a need to know, and all those W questions, and they think that everything is related to them. So if you're on the telephone and talking to someone, they're going to want to know who is it they're talking to because they think it pertains to them. For you, this repetitive questioning is slow torture. Those are the next two items, Marguerite. So if you just press down, keep going. If your child is questioning about activities, the TRAIN is very important because you can refer them back to the TRAIN. You can teach the child about the 3 times rule, which has to do with how you handle those repetitive questions. And you can also redirect the child's questioning to a preferred topic, and in the process, model conversational skills. Okay, if you move to the next slide, we'll talk about managing transitions and change, because the beauty of the TRAIN is that everything is queued up there. And so the child knows what's going to happen next. And so, but you're the engineer of the TRAIN. And so if you know if something is going to happen that's a little different, you can cue the child about the change, and you can reassure the child that their food will occur in the order of the day. So first we'll fix the flat, then we will go home, and then you will have your lunch. And then I want to mention the flexibility card, which Yvonne may have said something about, because this is a yellow, you can move on to the next slide. This is a yellow card, which means caution, but you can use any color for the child. But the important thing is that it alerts the child that something different is going to happen. On the other side of the card, you can have either pictures or words that talk about coping strategies that you've been able to use with your child. So for Yvonne, it was dance, your flexibility dance. And so you can begin the process of teaching your child some coping strategies that can then be cued when they need it with the flexibility card. And the other thing is that you should do these with the child. And so therefore, both of you will effectively have the experience of stress reduction. Okay, we can move to the next one, because the next one basically is about managing transitions because your child has difficulty switching tasks. We can go through these quickly, Marguerite, and has a poor sense of time passing. And you can verbally cue your child about the need for change, but many of our children are so programmed for visuals, they can use a time timer. And you may be familiar with this. If you are not, it's on the next slide. And the beauty is you can dial a certain amount of time in for both the duration of the activity. And so as the red amount decreases, the child knows that the time for that activity is running to an end. And then there will be a need for a transition to the next activity. Next slide. So I want you to know from this lecture, I think you have understood that food is just the tip of the iceberg in Prader-Willi syndrome. And the next slide is the summary, that challenging behaviors appear as the brain develops and the child learns. A high degree of structure and consistency and predictability in the home decreases challenging behaviors and parental stress, and that proactive measures of food security in the train provide the infrastructure to manage these challenging behaviors. Thank you for your time, your patience, for all that you do for our children with Prader-Willi syndrome across the world. Thank you to FamCare. Thank you to IPSO.